Hi, I am Dr. Felice Gersh, your integrative OBGYN physician. And today I'm going to talk to you about a really important and trendy topic, let me fix my camera here, the autonomic nervous system. And I will call queen of the autonomic nervous system is the vagus nerve, which modulates the parasympathetic nervous system. So in order to understand what this is all about and why it's so important, let me just tell you a little bit about the autonomic nervous system. Now, when I think autonomic, I think automatic, okay? It controls all the things that happen in the body that we never have to think about. Like, can you imagine if you had to think, okay, now I want my eyes to tear, and I think I should blink, and now I should make saliva, and now I think my temperature should go up or should go down. I think I should sweat. I think I should think about how my bladder is filling, how my digestive tract is working. Do I have motility now? How is my stomach acid filling? I mean, you can just go on and on. Of course, we could never think about all those things to control them. It's a miracle, right? It just happens all by itself. And did you ever think, like, how does my body know how to do all these different things at the right time? How does my pancreas know when to secrete digestive enzymes? How does my gallbladder know how to contract, to release the bile and the cholesterol? Well, it's all like a miracle. It's controlled by the autonomic nervous system. Now, let's talk about the two parts of the autonomic nervous system. The first part is called the parasympathetic. The parasympathetic should be the baseline. It's where you should be most of the time. Parasympathetic is controlled, as I mentioned, by the vagus nerve. Now, the vagus nerve is considered the 12th cranial nerve, but it's like a big finger of the brain that comes down, and then from it comes branches of nerves that go to everything in the body, like every organ system has a nerve that branches off of the vagus nerve. Now, the vagus nerve controls the parasympathetic, which is the part that should be where you are most of the time. It's like calm and everything's working right. You have a nice, calm, regular pulse. Your temperature is steady. You're not sweating inappropriately. Your digestive system is working. So sometimes people talk about it as rest and digest. You can sleep. You just feel calm. You feel like this is how the body should work. But we have the other part called the sympathetic. Now, sympathetic not as in, oh, I feel empathy. No. Think of sympathetic as in stress. So when you think sympathetic, think stress. Now, the word we use is induce. You should only stimulate the sympathetic nervous system, which is the stress response, when you need it, not when you don't need it. So when would you need to have sympathetic activation of the autonomic nervous system? Like you're in an accident, you're traumatized, you are lacerated, you're running for your life from a wild animal or crazy person, you're being invaded by pathogens like bacteria and viruses. Then you want your sympathetic nervous system activated, which includes activating the immune system to be in a more pro-inflammatory state. Now, if you're running for your life, what do you want? Do you need to digest your food at that minute? No, digestion is not a priority. So you're not going to be like having active digestion. What you want to do is breathe. You want to be able to get oxygen into your lungs. So your bronchial tree, that's, all the branches that lead the oxygen into the lungs, they want to be dilated. So you want to open up your lungs so you can breathe. Now you want your heart to beat fast so you can get the blood around really fast, okay? And you want to try to trigger more blood flow away from the gut to other areas, like to the muscles. Now, just in case you're injured and you're lacerated and you're bleeding, you want to make sure you don't go into shock. So your arteries are going to constrict and you're going to start retaining fluid. you will activate what's called the adrenergic as in adrenal. So your adrenal gland is like stressed. Okay, so you're going to make more cortisol. Now, if you have a lot of cortisol all the time, it creates insulin resistance and more inflammation and dysbiosis of the gut. But short term, if you have cortisol, which is the way it's supposed to be, just when you need it for an acute stress reaction, it reduces inflammation. So like say you're fighting an aggressor, someone who's attacking you, and you get hit and scratched and, punched in the eye. You don't want your eye to swell up. You don't want to feel all that pain so that you become disabled and can't fight back. So you have all that cortisol and it reduces inflammation so your eye doesn't swell. You don't feel so much pain, okay? So you can keep fighting to save your life, okay? But long term, we do not want to have chronically high cortisol. That would be harmful. So the sympathetic part of the autonomic nervous system is life-saving when you need it, okay? Now you know that the sympathetic should only be activated when you need it in response to a stressed situation. The parasympathetic should be everything's copacetic. I'm like happy, I'm calm, my food is digesting, I'm like my temperature is good, all that. That's where you should be most of the time when nothing bad is happening. Now, the vagus nerve is for the parasympathetic. What about the nerve for the sympathetic? Well, it's actually a series of ganglion clusters of nerve cells that are parallel to the spine, and they send out branches also everywhere as well. So we have these parallel systems, but the sympathetic should be calm most of the time. The vagus nerve should be active most of the time. The sympathetic should be off most of the time. Parasympathetic, vagus nerve on most of the time. So we have these like dual systems, right? Like the Chinese got it right, like the yin yang, okay? So we know that we should have these parallel systems, but only activate the sympathetic when you need it. Now, these are nerve systems, right? So nerves work with neurotransmitters. What neurotransmitter is the dominant neurotransmitter for the vagus nerve? It's called acetylcholine. Now, what about for the sympathetic nervous system? It's epinephrine and norepinephrine. Now, you may have heard of an EpiPen, right? So everyone's heard of EpiPens. When would you use an EpiPen? If you had a severe allergic reaction or like anaphylaxis, where you get an allergic reaction where your like mouth swells up and you start closing up your throat and you can't like breathe, okay? So you get an EpiPen and you're injecting epinephrine, because what did I tell you a little bit ago? That epinephrine, okay, that's the neurotransmitter for the sympathetic part of the autonomic nervous system. And when you activate the sympathetic, you open up the bronchial tree so that if you're running for your life, you can breathe. You want to get oxygen in. So an EpiPen, which is epinephrine, will open up your lungs. But what will it also do? Make your heart beat really fast, okay? So these are the different side effects of if you inject epinephrine, okay? And also epinephrine is included with a lot of local anesthetics like lidocaine, okay? And it causes vasoconstriction so that the local anesthetic stays in the area and doesn't wash out into all the other areas of the body by creating some vasoconstriction. The blood vessels constrict. That's why when you have stress, your arteries constrict and your blood pressure will go high. And if you're always in a stress state, you're more likely to have chronic hypertension and palpitations and tachycardia. Now, a lot of these things happen in what group of people? Menopausal women, okay? Now, so why is this happening? And then what are we going to do about it? Well, it turns out that those neurotransmitters I talked to you about, the epinephrine and norepinephrine, that is modulated by estradiol, the estrogen made by the ovaries, which of course you lose when you go through menopause and goes down with some crazy ups along the way in perimenopause. And acetylcholine, that's the neurotransmitter for the vagus nerve. Also, it doesn't work, it doesn't function properly, it doesn't get made properly in an absence of adequate estradiol. In the brain, by the way, acetylcholine sets and creates memories. It's about cognition. So that's one reason why women after menopause will sometimes get in perimenopause, like brain fog, and they are 2.5 times compared to men more likely to develop Alzheimer's disease. That's one of the reasons, okay, is because without adequate estradiol in the brain, you don't make enough acetylcholine, and you don't make enough and have it function properly in the autonomic nervous system involving the vagus nerve. Now, I said how the vagus nerve is coming out from the brain and has branches. Well, it turns out that these branches have what we call efferent and afferent, okay? So these mean that you have nerve transmissions that are going outward and back to the brain. It's bidirectional. So you have nerve signals coming from outside in the periphery of the body going up to the vagus nerve and then into the brain. Remember, the vagus nerve is connected to the brain and communicates very heavily with the emotional centers of the brain, like the amygdala, but other areas of the brain too. There are connections throughout much of the brain, and also in the hypothalamus that controls things like your temperature. So you know about things like night sweats and hot flashes. That's part of the autonomic nervous system's regulatory system. Okay, that's in the hypothalamus. But the amygdala, that's about emotions. That's also interconnected with the autonomic nervous system, the brain part. So we have afferent and efferent branches. The signals go to the brain and from the brain through the vagus nerve. So this is really really Now, I mentioned that the vagus nerve has branches of nerves that come off of it that go everywhere, including to the gut. And there are many nerve fibers that go from the gut back to the brain. So if you are a menopausal woman, perimenopausal woman, you change your gut microbiome. It becomes abnormal, what that we call dysbiotic. And then you do not make the right short-chain fatty acids, like they're called acetate, propionate, and the most important for the brain is butyrate, which actually, believe it or not, believe me, it has receptors on the vagus nerve. So when you eat the right diet and you have the right gut microbiome and you make this product of fermentation of fiber that you eat, you make this short-chain fatty acid called butyrate, and it actually goes onto the vagus nerve, binds, and it then signals to the brain, and it makes everything in the brain be happier. You feel calmer. You're actually activating the vagus nerve. So what you eat can actually tremendously affect emotionally how you feel and also how your body is working. That's one of the things we will talk about in a minute, about what are you going to do. We cannot change that we're going through menopause. We maybe can eat certain ways, more vegetables, and delay it a little bit, but 100% of women will go through menopause. It's only a question of when, not if. So we need to know that when you go through menopause and you don't have enough estradiol, the vagus nerve and the parasympathetic part of the nervous system becomes less robust, and you have more sympathetic. So you end up with more stress, and you put out more cortisol, which can interfere with your circadian rhythm, which is also regulated by estradiol. So then you're living in jet lag, and you don't feel well, and you don't sleep well. You feel stressed and anxious. And that's another reason why women also, because they have more sympathetic, they have more palpitations, anxiety. All of these things happen. And then I mentioned night sweats and hot flushes and memory problems and mood swings. Sometimes I call it road rage without the road. People get so angry, they want to bite everybody's heads off, and they say, why did I want to kill my kids? I love my kids. I wanted to I was so mad over nothing, and then they just berate themselves because their amygdala is out of control. They woof. They just explode, okay? So we do not want to be exploding females. We want to be calm and happy and controlled. So we need to have a good functional dysregulated autonomic nervous system. So, of course, one answer as you go through into the perimenopause and menopause is what I always talk about and love to every little cell in my body, deep in my soul, which is hormone therapy. But I always say this too, hormones are fundamental, they're necessary, but they're not enough. We can't just give hormones. We're not giving the same exactly like, not even close, to having 21-year-old ovaries. And of course, some 21-year-old women are pretty out of control too. They need a lot of the things I'm just now going to talk to you about. And as a side note, women with PCOS, because they do not make estradiol adequately, also have dysregulation. And there's many papers on this, that they are more stressed. So women with polycystic ovary syndrome, PCOS, also live in a state of sympathetic overdrive and not enough what we call vagal tone. The parasympathetic is overridden by the sympathetic. Too much stress. And then, of course, when you don't have the right right parasympathetic and right balance, you're going to get not just problems, as I mentioned, with stress and with heartbeat, but the neurological system of the gut is all controlled by the autonomic nervous system. And I mentioned that when you have good parasympathetic tone, all's good with the world, called rest and digest, you have proper motility of the gut, you have proper digestion, but you lose that. You don't have that when you don't have enough estradiol. That's why women with PCOS have more heartburn, more irritable bowel syndrome. Same thing happens in women going into the menopause. After menopause, women have much higher rates of GERD, gastroesophageal reflux, compared to men. And they have more gut problems. They get more gallstones, perimenopause and menopausal women, because their gallbladders don't contract right. And they have problems with digestion. They get dysbiosis. So it's really important to know that it's bidirectional, the signals from the gut and to the gut through the autonomic nervous system and including the brain. So let's talk about what we're going to do. I mentioned hormones. Okay, well, what beyond hormones? Hormones are necessary but not sufficient. Well, one of my favorite tools now is a vagus nerve stimulator. And so there are devices out there on the market, and they come in two types: auricular, that's on the ear, and that you can put next to your neck. There are others that may be on the chest. The ones I'm most familiar with and use in my practice, and also I own one, is the kind that you put next to your neck. And this is a direct approach. It just helps directly stimulate the vagus nerve because it's coming down from the brain, and so you can stimulate it here or through your ear and sometimes here. Now, they also have implantable ones, but we're not going to do implantables. We're going to use the kind that you can put on the outside of your body. And what else? Well, all the mind-body practices that you've probably heard of, like every form of meditation and guided imagery. It's amazing how you can actually control your autonomic nervous system and increase vagal tone through your mind, through calming brain waves. So definitely take up one of these practices. For me, I love guided imagery. There's no training involved, and there are many apps, and you can listen to a beautiful voice, some background music, and it takes you on a mind journey where it tells you to imagine like you're in a beautiful place in the mountains, in the meadows, but you imagine it yourself. And then it will take you on sort of a stroll through calming, okay? So you want these calming apps, guided imagery. And there's many, many forms of meditation. All are wonderful. Taking a walk in nature can increase vagal tone. Other things like laughing. So I advocate to my patients all the time, go Google it. Laughter yoga. It's a real thing. The way you do it, and I learned about this in my integrative fellowship, especially it's great if you do it with a partner, but you can do it with yourself, like in front of a mirror. You just act super goofy, like a pantomime, like you're Cupid trying to shoot arrows, you're riding on a horse, and you're just jumping around, or you're just like super goofy, and you laugh like laughter track. Like it's coming from a comedy TV show on, and you just have this laughter track. And you just laugh at the top of your lungs. It doesn't matter that it's all artificial. It changes how your vagus nerve is being functional. So it activates it. So laughter yoga, or just laughing, that's why people feel so good when they go to a comedy show. Like, go to the improv and laugh. You'll feel better. I tell some of my patients, go and get a joke book. And it doesn't matter that it's corny, it's dumb, it doesn't matter. You and your family, whoever, or friend, tell each other jokes. And then say, it doesn't matter how goofy or dumb or corny, you have the other person and both of you laugh, laugh, laugh at these jokes, okay? Laughter is real medicine. It increases vagal tone. And what else? Breath work. So I learned in my fellowship the breath work where you take in a deep breath for 4 seconds through your nose, then you hold it for 7 seconds. You just hold it deep, you get deep in your lungs. And then you breathe it out slowly for 8 through your mouth with a whoosh sound, like. So in through your nose 4, then you hold it for 7, and then out through your mouth for 8. That is actually activating. Do that like 5 times in a row, a few times a day. It activates your vagal nerve. Your vagal tone is going to rise. Your vagus nerve is going to be happy, and you just feel calmer. It's not optional to do these things because you need it. By the way, even if you're not going into menopause and you're, just life stress can activate your sympathetic nervous system. If you're always stressed because you don't like your job, your family is bugging you, whatever, you can be in a state of sympathetic overload all the time. Also, even if you have functional ovaries, okay? So everyone should be doing these things. It's so important. What else? Exercise, especially vigorous exercise. That will really improve your sympathetic versus parasympathetic ratio. You're going to have more vagal tone, and you'll down-regulate your sympathetic with exercise. And what else? Well, there are adrenal adaptogens. Now, you don't have to be an expert in all the herbs, but I'll tell you a few. If you only know one, the one you should know is ashwagandha. Now, this is Ayurvedic herb. That means it comes from India, and I call it the great leveler. If you're really wired, it will calm you down. If you're like barely functional, like I'm so low, I don't want to move out of this chair, I'm just, I'm a slug, it will raise you up, okay? So if you only know one adrenal adaptogen, that's what they call it because it's dealing with your adrenergic system, it should be ashwagandha. But there's so many other. There's skullcap, there's rhodiola, there's licorice, there's ginseng. So there's a whole bunch of them, okay? And then there's the calmative ones, like lemon balm, passion flower. But if you don't want to become an herbalist, just stick with ashwagandha, like 500 milligrams a couple of times a day. And herbal teas. So if you're like stressed a lot, some of my favorites would be holy basil, also known as tulsi. Kava is fantastic. And that old standby, chamomile. Okay, so those are all amazing for helping to regulate and sort of neutralize that stress state. Okay, and another very interesting thing is cold plunges. Now, I guess the Finnish got this right. They understood that if you get all steamy and then in a steam room and then you do a cold plunge, it's really good for you. It's actually amazing for you if you can do this sort of thing. Now, maybe you're not going to a Finnish sauna and then jumping into like a cold pond or something, but what you can do is take a hot shower and then turn the water on cold and just have the cold water go all over you, or fill the bathtub with cold water and just lie in it for a little bit. Okay, now at first it seems crazy, it's so cold, but it's really great to balance your autonomic nervous system. Another thing that I love, one of my favorites, is massage. Okay, massages are great, and craniosacral and acupuncture. We didn't know, how does acupuncture work? Well, now we know it works by helping to balance the autonomic nervous system. So that is another really wonderful thing to do. So let me just check here. Oh, going out with your friends, socializing, just having fun. Being lonely is really bad for your autonomic nervous system. So having friends and just going out and socializing. I'm just checking my list here. Oh yes, essential oils. So if you only know one essential oil, which one should it be? The universal, lavender. Okay, so lavender is fantastic. Now, there are many others. Ones that you may like the scent of more than lavender, if you don't like that sort of flowery scent. Lemon. Lemon essential oil is very calming. It can help you sleep. It's wonderful. So if you don't like that sort of flowery lavender, learn one other. And then you can get books on aromatherapy and become an expert if you want, because there are many amazing ones that are really calmative. And you can buy blends. You can go and get organic blends that will say like calming oils and so on. And there'll be blends that you don't even have to know what they all are. So, but if you just want to do a straight one, go with a little bit of lavender and try lemon oil, because lemon is refreshing, and men like lemon too, where they may not like the smell of lavender on them. So I'm just checking here so I don't forget anything, because it's a really long list. So another one is singing. So singing at the top of your lungs is wonderful for increasing vagal tone. People love sing-alongs. Just sing. And if you don't want to sing in public, sing in the shower, as most of us love to do. And what else? Something that you may or may not like to do, called gargling. So it turns out gargling can increase vagal tone. And I'm just checking here. I think I hit them all. There's probably a few others, but these are the main ones. And don't forget, get some sleep, okay? Circadian rhythm is very critical. The autonomic nervous system regulates directly the immune system. It actually can calm the immune system down. Like I said, it can cause it to go into an inflammatory state through the sympathetic. And we do not want to be all inflamed. And if you have circadian rhythm dysfunction, the immune system is very circadian. You're going to go into a more pro-inflammatory state. And when you're generally inflamed all over, you're going to get neuroinflammation. That's only going to aggravate the situation even more. So it's really important to control your autonomic nervous system, to have more vagal tone, and to keep the sympathetic part calm, except when you need it, which is life-saving, but most of the time you just put it on the back burner and be in a state of vagal tone, the way nature wants us to be. So stress, chronic stress, is basically overactivation of your sympathetic nervous system. And every woman, every woman who goes into menopause is going to be in a state of reduced autonomic nervous system of the type was involving the parasympathetic and the vagus nerve, and too much sympathetic part of the autonomic nervous system. Every woman, because estradiol modulates the autonomic nervous system and the vagus nerve. So I hope this is really helpful, because this can change your life. Going through these different things I mentioned, and they're hard to remember. That's why I had a little list here, just so I don't forget them. It's really important. Pick out a few key ones and make sure you incorporate it into your life all the time. Even if you're on hormone therapy, remember, hormones are necessary but not sufficient to control and manage the proper output of the nervous system, that incredible autonomic nervous system, for which the vagus nerve should be the dominant function of it, okay? So I hope this is helpful, and remember, vagal tone keeps you healthy.